many of these risks, and many of us with aging parents, it seems like there's a parallel risk to these things.
Absolutely, absolutely. When I first got into looking at injury epidemiology, one of the very first studies I did was about drowning in Los Angeles County. And what we discovered was there are two peaks, under 5 and over 65, as you just described. And the drowning profile for those two age groups is very similar. They drown in backyard swimming pools and they drown in bathtubs primarily. That's also true of pedestrian injuries. It's also true of falls. So those two age groups do have similar injury profiles, and just recently we've been doing, up until a few weeks ago, very well with toddler drowning. This year we had 0 up until about 2 weeks ago, fatal drownings. But we've noticed an increase in the past several years in elderly drowning. And we are doing a study now to try and figure out what exactly is going on, because it's hard to tell. We need to get a message out, and we're not sure exactly what's causing those drownings, so we need to take a closer look at that.
As far as just carrying this parallel through with automobile and pedestrian, what about the senior drivers? What can a senior driver do to try and protect themselves? I mean, your visual acuity, perhaps peripheral vision diminishes a little. People are driving faster. As the West Valley PD is constantly enforcing speed laws because it's such a primary cause. What can a senior driver do to kind of increase their chances of survival from their house to the grocery store and back?
Well, there are courses now being offered to senior drivers to sort of remind them, because I think what happens to a lot of people as you get older and you've been doing something most of your life, you sort of figure you know how to do it very well. And I think it's difficult to say, you know, gee, maybe my response time isn't as quick as it used to be. I can identify with that very clearly, or my eyesight and my peripheral vision isn't as good. So we do recommend that the DMV offers a course for senior drivers. ARP offers several courses for senior drivers, and I think it's a good idea. I think it's just to sort of remind yourself that, you know, if you're not going to go as fast as the traffic on the freeway, maybe you don't want to get on the freeway. Maybe you want to find another way to go, and that you do maybe want to take somebody with you so that there are two sets of eyes there.
Isn't there a little fear, though, gee, if I go and take the ARP class or I go and take this DMV class, well, then they're going to say, well, you know, you shouldn't be driving anymore?
Well, I guess there's that fear. I think as long as you take the class, the chances are better that you will pass your driving test, because I think now that there will be a requirement that senior drivers will have to take a driving test every so often now too. But you know, think about it too in terms of sometimes we do have to give up some of the things we do. It's better than, you know, winding up hurting somebody or really hurting yourself.
Before we run out of time, I want to make sure that people know how to get hold of you, because I think we've addressed some of the issues. I think people might want to get more facts. People might want to get more information specifically about programs, places they can get some of the classes, the lessons, the services. Can you give us your phone number so we make sure that people have that available to them?
Yes. Our phone number at the Department of Health Services Injury and Violence Prevention Program is area code 213-351-5224. And we can provide information about car seats and vouchers. You can get a voucher by attending a class to get a car seat. We can make recommendations for drowning prevention. We talked about the WATCH program. We also have bicycle helmets, and working with some community-based agencies, bicycle training and bicycle helmets. So we're happy to have people call, and we can provide them with information.
And what's your pardon me? What's your website?
Website is lapublichealth.org, www.lapublichealth.org. And once you get on that website, then just click on Injury and Violence Prevention Program.
So a lot of this stuff is it seems like common sense. We overlook it. It seems kind of, in some cases, almost mundane. Oh, I don't want to be a worrywart. I don't want to run around, running around saying, it's like when we first bought the little plug covers.
Yes.
You know, you kind of feel a little neurotic saying, you know, oh, plug covers or, oh, you know, this, that, or the other. But I guess it's something that you try and feed your children well, you try and clothe them well, you try and educate them, and the rest, that these preventable.
They are preventable. I mean, almost all of them are preventable. And the other thing is, if you need something to bolster your resolve to make sure that your child does not get injured, and you do take these precautions, remember that injury is the leading cause of death for the population less than 35 in Los Angeles.
Really?
Yes. Yes. Leading cause of death.
So this is this is something that people probably should take a hard look at. And
it's so preventable. Right. Most of them are so preventable that it doesn't have to happen.
Well, I hope that some of our viewers will take you up on your offer, go to your website, call you, or check on our website, accessstimewarner.com, and we'll connect them to your website. And I want to thank you again for being here.
My pleasure. Thank you for having me.